Today, social media has also reached the healthcare industry. Hospitals and other healthcare providers can use social media platforms such as Facebook not only to raise their awareness, improve their image, stand out from competitors, but also enable patients to voluntarily participate in suggestions for improvement and collaborate in a better way with hospitals and other actors, thus to deliver health as a service. The basic idea of health as a service is that it clearly defines that the customer or patient wants to consume health just like a service, viewed from a holistically macro perspective. For him, the overall goal is to be healthy and not to talk to a physician, talk to another doctor at the hospital, or to bring several documents on his own. Social media platforms can be transformed into health as a service platforms. Those service platforms are set up as digital platforms, building on a network or ecosystem of actors which interact and exchange resources, thus co-create value. They also serve as a means for service innovation because the combination of resources among many interacting actors can lead to innovative solutions as defined by Lush and Nambasan in 2015. This approach is pursued by startups like Airbnb, Klarna, Uber, and big data players like Google, Amazon, or Alibaba, who use external ecosystems for service innovation enabled by platforms and ecosystems. The core of the platform view is the shift from resource control to resource orchestration, from internal optimization to external interaction. The question is how hospitals configure and apply social media platforms to orchestrate collaboration among multiple actors to achieve service innovation. In this study, we compared the Facebook presence of German and US hospitals. To examine the media presence of the hospitals on Facebook, only Facebook pages operated by the hospitals themselves were taken into account. For the sample selection, both countries were divided into regional areas, Germany according to the federal states, the USA according to coasts and cardinal points, into 8 areas. The drawing of the sample was made by a proportionally stratified random selection. The survey period ran from January 1 to September 30, 2017. To be able to determine what content and what types of contributions hospitals share, a coding system was developed with the following 3 categories. 1. Call to action, yes or no. 2. Type of post, live stream, text post, survey, external link, photo, video or event. And 3. Content of the post, disease, healthy lifestyle, entertainment, health policy, self-promotion, or third-party advertising. With the aid of software for computer-assisted qualitative data and text analysis, so-called MaxQDA, the individual contributions were coded. A total of 1,258 contributions from German and 1,621 contributions from U.S. hospitals were analyzed to further investigate the topics of healthy lifestyle and entertainment. A key finding of the study is that calls to action prompting Facebook users to respond, for example, sharing experiences, were hardly used in both countries. Of the total of 1,251 German posts studied, 7 contained a call to action. Among the 1,621 U.S. posts, 12 did. Hospitals prefer unidirectional communication with different audiences on Facebook, leaving opportunities to share resources and promote service innovation untapped. Regarding the type of posts, both countries differ significantly in the categories of event and video, meaning that German hospitals post more frequently information about upcoming events, whereas U.S. hospitals share more videos. Significant differences were also found in the content of posts: self-promotion, entertainment, disease, third-party advertising, healthy lifestyle, and health policy. Overall, the results suggest that German hospitals use Facebook primarily for advertising their services and information purposes, whereas U.S. hospitals entertain and educate their users about health topics. So, let's summarize our key takeaways from today. The use of social media and moreover specialized engagement platforms has benefits like raise their awareness, improve their image, stand out from competitors, but also to deliver health as a service, which is that the customer or patient wants to consume health just like a service, viewed from a holistically macro perspective. Health as a service platforms facilitate the exchange of resources of a network of actors and therefore serve as one important pillar for service innovation. A platform perspective on innovation emphasizes resource orchestration, external interaction, and value coming out of an ecosystem. Both German and US hospitals still use Facebook primarily for unidirectional communication, and only start to interact with patients and other partners, which is the basis for innovation in ecosystems. While German hospitals primarily inform and advertise, US hospitals entertain and educate about health topics.